Reagan Elizabeth Miller was born on February 2, 2002 to Brad and Misty Miller. I was born with a rare syndrome called moebius syndrome. Moebius syndrome was named for Paul Julius Moebius, an Austrian neurologist who studied patients with this condition in the 1800s. Moebius syndrome is a rare congenital disorder that results from a problem in the early development of a child's nervous system. People with Moebius may not be able to smile, frown, or make any other facial expressions. They often cannot blink or move their eyes from side to side. In some cases, the syndrome is also associated with physical problems. It is believed that whatever it is that occurs to the nervous system happens in the first trimester between days 20 and 26. This problem may cause a pattern of defective growth for the remainder of the pregnancy. Children with Moebius usually have complete or incomplete paralyzed facial muscles because of a damage to the 6th and 7th cranial nerves. The 6th nerve is the abundant nerve, and this nerve controls the ability to blink and move the eye laterally. The 7th nerve is the facial nerve. This nerve controls the muscle of facial expression, serves the taste buds on the front 2/3 of the tongue, and sensation to the skin of the fingers and toes. Because several cranial nerves may be affected, a variety of problems may occur. The most apparent symptoms are related to facial expression and function. In newborns, the first sign is an impaired ability to suck, which may be accompanied by excessive drooling and crossed eyes. It may present itself more prominently later because people with Moebius most often cannot smile, frown, or make other facial expressions, and they often cannot blink or move their eyes from side to side. They cannot show anger or worry in their foreheads. In some cases, the syndrome is also associated with physical problems. Those problems include a cleft palate, hearing loss, cleft foot, as well as missing limbs or digits, low upper body muscle tone, and again, they can include swallowing problems, crossed eyes, and facial muscle paralysis. No one knows for sure what Moebius is caused from, but there are theories. Some doctors believe that their nerves do not develop properly or at all in utero, or that the nerves developed may be destroyed shortly before or after the birth of a child. It affects boys and girls equally, so there are no specific genders on who has it more and who doesn't. There is no prenatal testing that can be done to check for Moebius in utero. It can affect twins, with one twin having it and the other not be affected at all. Moebius is treated by some infants are required feeding tubes to maintain sufficient nutrition. I had a G tube, which is right above my belly button to the left side of me, and that is the way I was fed up until I was 5 years old because I couldn't properly get the nutrients I needed from eating correctly. Crossed eyes may be corrected with glasses, patches, or surgery. I have had glasses since I was 15 months old. Therapy may also be needed to improve oral stimulation and girls' fine motor skills and coordination, including physical, speech, and occupational therapy, and I have had all 3 of those. I had speech therapy from the time I was 1.5 years old up until 6th grade when I graduated. A lot of people want to know if there's a cure, and unfortunately there is no cure because the damage to the cranial nerves is usually permanent. However, there can be improvements made with therapy and medical management as well as other sources. Some children have severe and even life-threatening problems. Others have mild problems that respond well to medical therapies and treatments. I am one of those people who have mild problems. I do not have any severe life-threatening problems from Moebius. I have Moebius syndrome, which means I have a paralyzed face. I have an incomplete paralyzed face as only the left side of my face is paralyzed. I was born unable to smile and close my eyes on command completely. I cannot blink right. I frown or show any facial expression. I do not have the 6th and 7th cranial nerves, which control blinking, lateral movement of the eyes, and facial expression. Believe me, I much would have rather been born with something else because it hurts at times. The hardest part about having moebius is that it's so rare, nobody except for other people with moebius really know what it's like to have it. 1 in every 250,000 babies are born with moebius each year. Besides the facial paralysis, people with moebius can have some type of speech difficulty. Some people with moebius are also born with fingers, club feet, or missing limbs, or small mouths and tongues. I do have a small mouth and tongue, but I have all 10 fingers and all 10 toes. The hardest part about having a facial difference is when I am teased, looked down upon, or thought to be weird or weird looking. I need people to understand how important my teachers are in helping me and my family and my friends, because I could not have done it without them, and I am not the woman I am today without them standing beside me and showing how much they love me and that they will never leave me because of something so rare. I have all the same feelings and needs and emotion as anyone else. I can't show it in my face. I have to use my voice and my body language so that people understand what I am feeling. I often feel embarrassed having moebius, and I'm not always sure how to handle this when it hurts. People tell me, oh, I understand what it's like, and no, they don't, because it's so rare that I know that they don't have it. I am going to Dakota State University to major in elementary education and special education because I want people to know what it is like to have a disability so rare. I want kids to know that it is okay to have a disability because everyone in the world has some type of disability, and it pains me to ever think that some kid should just feel off because someone is making fun of them. I graduated at the top of my class in high school with a 3.7 GPA. I was involved in everything there was in my high school, and I lived a normal life as normal as I could until COVID happened. But I want kids to know that you are in charge of your own life, and you can live as normal as a life as possible, and everything will still be okay at the end of the day.